joined us for today's discussion. I'm honored to lead today's panel discussion as we here at Cook County Health celebrate our 2025 Black History Month celebration. I'd also like to thank our panelists who joined us today for this discussion. You'll be hearing from them shortly. And before we get started, I'd like to give and acknowledge two of the folks leading the organization here who provide stewardship and make certain that we all stay on the right path. First up is Cook County Commissioner Bill Lowry, who is also the Vice Chair of the Cook County Health Board of Directors. And following his welcome, you'll hear from Dr. Eric Makaitis, CEO for Cook County Health. With that, Commissioner Bill Lowry, thank you for joining us today.
Well, thank you for having me. I'm very excited to be a part of this amazing panel as we also talk about Black History Month. And Black history is actually American history. So I look forward to this conversation.
Thank you so much, Eric. Dr. Makaitis?
All right. Well, thank you, Shannon. And I, too, am extremely honored to be here today as we celebrate Black History Month and the contributions that African Americans have made to medicine and to our county health system. Because it needs to be said, diversity is not something that we should be afraid of. It makes us stronger institutionally and as a country. Cook County Health's own incredible legacy is built on the excellence of many outstanding African-American men and women, including surgeon Dr. Daniel Hill Williams, who established Provident Hospital, the first Black-owned and operated hospital in the country, and Dr. Agnes Latimer, who was appointed medical director of Cook County Hospital in 1986 and was the first African-American woman medical director of a major U.S. hospital. I highlight them, but of course, there are countless other more African-American individuals who've dedicated their lives and careers in service to the residents of Cook County, and that continues to this day. And we're fortunate to have built a staff that focuses on excellence and building skills, but one that's also reflective of the diverse patients that we serve. Again, diversity is not something that we should be afraid of, but instead we should embrace. So thank you, Shannon, and I'm going to turn it back to you to engage with this great panel.
Thank you so much, Dr. Makaitis. I'm also super excited that Dr. Makaitis and Commissioner Lowry are going to stay with us as long as possible so that they can participate in this robust discussion. And so let's start the discussion. I'm super excited to see in little boxes on the screen here my colleagues from across the organization. I think what we'll do to get started is I'd like to ask each of you, and we'll go in alphabetical order, to tell us a bit about yourself, introduce yourselves, let us know what you do here at Cook County Health. And then the nugget that you're going to lead with before you transition is to tell us how long you've been a part of the Cook County Health family. So with that, I'll call you by first names, and this will be the order that you will go in: Priscilla, Deborah, Mark, and Marlee. So with that, Priscilla, welcome.
Hi, good afternoon, everyone, and happy Black History Month. I am Priscilla Bennett. I'm the current clinic manager for Robbins Health Center. We're located in the South Cluster region of Cook County Health. I have over 20 years of experience with healthcare sector. My experience also included thorough account client management to ensure the delivery of personalized quality service. We also strive in our monthly KPI, monthly objectives to ensure that we meet our goals. I am result-oriented professional with a high degree of integrity and flexibility, and I know how important other skills are in the performance of healthcare. I pride myself to excel in the organizational analytical ability here at Robbins Health Center, and I'm very passionate about assisting a broad range of diverse patients that come into our clinic. Patients of Robbins are basically our family members, and I've been with Cook County for a little over 7.5 years, benchmarking on 8 years.
Nicely done. Thank you so much. Deborah?
Good afternoon. My name is Deborah Crooks-Reed, and I'm one of the clinical lab supervisors here at Provident Hospital. My role as a medical technologist is to provide oversight of lab tests performed on patient samples, starting with accurate sample collection, testing, and result reporting. I have been here at the county for 20 years, well, 21 years as of February 23rd, which I'm very excited about. And I've been a med tech for 40 years. Boy, but I enjoy what I do.
That means you started as a baby, Deborah.
Of course.
Next, we're going to kick it to Mark, Dr. Mark Grevious.
Hello. Thank you all for inviting me to this wonderful panel. I'm really excited to be here. Again, my name is Mark Grevious. I am the Chief of Plastic and Reconstructive Surgery here at Cook County Health. I started here in 2003, so this is my 22nd year here. I often tell people that I run into that this is the best job I've ever had. And it's because we take care of patients that sometimes other people don't want to take care of. There's I always think of this concept called C cubed, which is a cultural connection to the community. And I believe that us as providers, especially the few African-American providers that we have to have this cultural connection to the community. And that's what we have here at this institution. My responsibilities here are to manage the day-to-day operations and plastic and reconstructive surgery. We do a significant amount of breast reconstruction, abdominal wall reconstruction. We do a significant amount of hand and upper extremity reconstruction as well. In this institution, we do lower extremity reconstruction for orthopedic surgeons. We help out neurosurgery. So we are often consulted by nearly every surgical subspecialty in the hospital. And again, I'm happy to be here today.
Thank you so much. And last but certainly not least, we've got Marley Hendricks.
Thanks, Shannon. Hi, I'm Marley Hendricks. I am the Director of Public Health Administration here at Cook County Health. I am the proverbial Wizard of Oz for the health department. All of the shared services report up through me and my team. So that is financial operations, both grant and corporate. That is procurement. That is facilities. That is everything kind of human resource adjacent. I'm a fixer. I'm a fixer. I am working on my second year here and very, very pleased to be here with you on this panel today.
Thank you so much. I think what our audience will see in this, and it was really important to us that we have diverse voices as we talk about Black History Month, to talk about representation and what it means to work in healthcare. There are those fields that are obvious to folks, but what people don't often realize is that there are many, many layers and roles that people play in the healthcare space. And so one of the things that we're going to be tackling today is representation and why it is important. And so I think with that, because we have loads of questions to get to, where I want to start in this discussion is to learn a bit from those who are actually on the front lines here about what made you get into the medical field, be it by way of medical school, public health, management. Tell us a bit about what about healthcare and medicine was attractive to you. And then also if you could do it through the context of what was your experience like with interfacing with people in the profession as you grew up or in your entering into career life. With that, I think we will start with you, Dr. Grevious, if you don't mind. What drew you to become a doctor, and what was your past experience?
Sure. So I didn't have much past experience. I often share with people, and I've spoken to Dr. Makaitis about this, is that you can't be what you can't see. And this whole concept is that I really didn't have a lot of role models. I'm the first physician in my family. I always loved people and wanted to connect and always wanted to help people. So that was kind of my introduction. So since I was in the 7th grade, my mother tells me that I've been pushing to be a physician, and not just a physician, but always wanted to kind of be a surgeon. And when I was in medical school, initially I wanted to be a trauma surgeon, but quickly I figured out that being a trauma surgeon wasn't kind of my pathway to success. What was plastic and reconstructive surgery, because we do so many different things. We, again, we help neurosurgeons, we do skull-based reconstructions, we do craniofacial surgery, maxillofacial trauma, we have to know the anatomy from head to toe as a reconstructive and plastic surgeon. And the diversity in plastics really kind of pushed me forward to it. And, it's not really just about lifespan. I learned it's about health span. That term is coined by Peter Battia. I don't know if you've read this book, Outlive, but it's a great book. But he talks about not just lifespan, but health span. So, with reconstructive surgery and aesthetic surgery, you might think, well, we're doctors that kind of are the doctors to the stars and are kind of laser focused on aesthetic surgery, but plastic and reconstructive surgery is so much more than that. Patients who have breast cancer, we do restorative surgery. Patients who have had bad car accidents and have significant maxillofacial trauma, this is restorative surgery because it's not, again, just quantity of life, but it's quality of life. And kind of that's my story.
Thank you for that. And I think I heard you say in second grade, you knew you wanted to be in medicine?
Yes, seventh grade, but yes.
Seventh. Okay, that's still very young. I would argue that's a calling. Thank you for that. Next, I'm going to go to Marley. Maybe Marley, you can tell us. You're in our public health department. Tell us about your path to healthcare.
Yeah. So my parents, growing up in Detroit, were EMTs. They were emergency medical technicians. And so I grew up in a pretty hyper clinical, hyper aware of emergency kind of medical mitigation environment. So I always thought I was going to be a physician. And I, went to undergrad with the intent of being a physician. But while in undergrad, while studying pre-med, I couldn't pay for it. So I ended up working for financial services while in undergrad, while still studying pre-med. And it turns out I had a knack for that. And while I was still studying pre-med, I got to this place where I realized I wasn't big on one-to-one interactions. I actually prefer population-based stuff. And so, I finished, my undergrad studies, still put myself through school, working in financial services. And I got my first master's in public health. And my first master's really focused on so it came together because I had an opportunity to help draft a strategic plan for Chicago Department of Public Health. And that was a moment because, I was like, look, there's a place for me. There's a place for the misfit toys who want a place in healthcare, who know that to drive policy forward, to, enable the providers and all of the frontline folks, you got to pay for it and you have to plan for it. And so that became my thrust forward. And that's a very nonlinear way how I came here.
No, that part, I loved a few things that you said. You got to pay for it. That's very relevant. But I also think it's interesting because earlier on, you talked about being a fixer and that you like to fix things. And so it's not lost on me, your path and journey and the fact that your parents were in the space. So thank you for that. Deborah Crooks-Reed, perhaps you could tell us a bit about your journey.
Okay. I always enjoyed science classes in school. That was my favorite subject. And in high school, I was involved in the program that allowed you to explore a health career program. And one time, a guest speaker was a medical technologist. She explained what her job was, and she brought a microscope and slides and petri dishes, and I was sold. I'm like, I'm going to be a med tech. And as a matter of fact, she was from University of Illinois. She was at that hospital, and I was just sold. I liked the idea of trying to not so much fix, but find out why, what's going on. Let's solve the problem. And that's the big thing of what happens in the lab. And I've always enjoyed that. So that's how I got to be a med tech. But like Dr. Grievous had mentioned, it's all about exposure. Most people don't think about, well, when I give blood, what happens? So it was exposure.
I love that. You guys, I think this conversation, because I know that both Commissioner Lowry and Dr. Makaitis are just chomping on the bits to talk about some things that we are doing here as an organization related to scholarships and pathway finding. So I think that this is a nice precursor and is such important background to the infrastructure and the importance of being intentional about representation. So thank you for that. Lastly, Priscilla Bennett, tell us about how you landed in healthcare and what was your experience with healthcare professionals growing up?
Well, I've always been drawn to helping others, and I think my early experience with healthcare shaped that interest. Growing up, I had my mom, my aunties, my cousins who worked as nurses. My mom actually worked at the Oak Forest location in the 70s and 80s until my sister and I, am a twin, was born. Now, I often heard stories of how they made a difference in people's lives. And when I had the same personal experience within healthcare, I saw firsthand how important it is to have a career in the medical field so I can contribute to people's well being in a meaningful way. It was always a natural fit for me because I've always been passionate about both healthcare and helping others. However, bedside was not my jam at all. I give it to you, Deborah, for the blood, but I love the business side of it, the administration side, the operational piece. And I still bring a great compassion to the patients here at Robbins Health Center.
Very good. Thank you for that. So now we've got a little background about folks who are in the field and on the front line. I'm going to turn the page slightly because we're lucky in that we have such a large footprint across Cook County, and one of our gyms is located on the south side. Commissioner Lowry, if you don't mind, I'm going to toss the next question to you. You're responsible for the 3rd District of Cook
Right.
County, which is where Provident Hospital is located. Can you talk a bit about the importance of Providence on the South Side, in the neighborhood, in the role and relevance it's made from a Black History Month perspective, from a community perspective?
Sure, I'd love to. And let me say this, I'm also going to address your previous question and share how it is I've gotten into healthcare. Shannon, first of all, let me thank you for your just so valuable and generational work for the entirety of Cook County for a long time. So I appreciate you, and I'd be remiss if I didn't say that. In addition to serving as Cook County Commissioner of the 3rd District, and I've done that now for over 6 years, as you said earlier, I serve as Vice Chair of the CCH Board of Directors, but I also serve as Chair of Health and Hospitals, the committee of the Board of Commissioners. And I want to first really shine a light on my predecessor, Commissioner Jerry Iceman Butler, who we lost last Thursday. But he really modeled how to ensure 2 things that are very important, and 2 things that I think others need to consider each and every day. And that is the importance of access to healthcare throughout all of Cook County, in all of our communities, and overall health equity. And those are 2 pieces that have guided my service, certainly over the course of the last 6 years. And those were also the tenets of my brother, Dennis Deere, Commissioner Dennis Deere, who we lost last June. Dennis and I were seatmates, and Dennis is my immediate predecessor as Chair of Health and Hospitals. So the service has been modeled, and it's service that I take very seriously each and every day. You know, as I serve as Cook County Commissioner of the 3rd District, I focus on 4 main pillars: economic equity. I focus on education and apprenticeship opportunities. I focus on criminal justice reform, and I work with others in trying to triage the violence that we see in too many of our communities. And then the 4th pillar is healthcare, traditional and behavioral. And as I get older, not only in this space, but just overall, whatever I'm doing, I ask myself, what is your why? And I invite all of us to say and ask, what is our why? What's become very evident to me, my why is healthcare. So over the course of my service in this space, I have been proud to represent what is truly a gem of the 3rd District, that is Provident Hospital. And just during that time, we've seen various things which have really reshaped our community in various initiatives, which really represent the access to healthcare that I'm talking about, that represent the health equity that I'm talking about. We've seen a new dialysis center which was opened at Provident. We've seen the resumption of ambulance access to Provident after 11 years when that access was not available. That's a game changer. If you have an exigent situation, an emergency situation around the corner, why should you have to be in an ambulance and go past Provident to get the treatment that you need, the acute care you need? So that's a game changer. We've cut the ribbon on a new MRI center. The import of that cannot be overstated, as MRIs are used to confirm diagnosis or rule them out. They're used to determine the severity of strokes. They're used to determine whether someone has cancer. In fact, it was a pelvic MRI which revealed that I had prostate cancer in 2019, and which again revealed I had kidney cancer in 2023. But because of early detection and the ability to have such a scan, I'm here to join you today. So yes, I'm a part of healthcare as well, and it's not based on what I've heard or what I've read, but instead what I've lived. And that's why through Provident and through Stroger and through our entire system, I just continue to be so proud that we stand for one simple principle that is huge, and that is healthcare is a right for all, not a privilege for a few. That is our work, and that has been the work at Provident. I'm also very proud of the Provident Scholarship Fund. Over the course of the last 3 years through that fund, we have resourced students who are studying for careers in healthcare, and our students come from historically disinvested communities of Cook County. And over the course of the previous 3 years, we have resourced our youth to the tune of $2.3 million. That is huge, and we're going to continue to do so. But this is an example of an initiative which really invests in our community, it invests in our children, and it invests in Cook County. And the other thing I want to just share is how wonderful it's been to collaborate not only with my colleagues on the Board of Commissioners and with President Preckwinkle, but with Dr. Makaitis and with CCH overall. And thanks to all of you, I'm so proud that last month we launched my birthday health screening program. And now because of this program, women throughout Cook County, 40 or older, will be able to get free mammograms, whether they have insurance or not. Men 45 and older will be able to get free prostate screenings, whether they have insurance or not. And we're going to see, because of this program, early detection. We're going to see overall wellness, but we're also going to save lives. As we speak today, there's a 30-year life expectancy difference between those who live in Inglewood versus those who live in Edgewater. It is important and, in fact, incumbent on electeds like me, on community leaders like you, on physicians like you to do something about it. And because of our collaboration, we're going to do something about it relative to the birthday health screening program. I call it that because I've said for 6 years, as I'm in the community and I'm talking to many who are listening to all of us now, gift yourself once a year with the physical. Do it around your birthday, if at no other time. You won't forget. So I'm encouraging all to call and set up their screening during their birthday month. If it's not your birthday month, still call, and we'll see what we can do to make sure that you're able to engage in early detection and just knowledge about what's going on in your body. Whatever you have to deal with, it's better if dealt with early as opposed to later, and I'm an example of that. I'm going to give you one real life example, and I want to brag about Provident before I pass the baton. Every year, I have a men's health fair, and I've been doing it for the last 6 years in collaboration with Apostolic Church of God. And I was doing a radio show September of 2023, right before that year's men's health fair. And I always hold the health fair in September because September is Prostate Cancer Awareness Month. So I was doing a radio show, and a gentleman called in, his name, Ricardo Mendoza. Shannon, I can use his name because he's allowed me to do so. He called into the show and he said that he had a PSA, the prostate specific antigen test. And the PSA is determined through the taking of your blood. And his reading was 16.4. Doesn't mean he had prostate cancer, but it means you have to continue the process of determining what's going on. He was given a MRI of his pelvic region, which showed inflammation. Again, might mean you have prostate cancer, might mean you just have inflammation. He was scheduled for a biopsy, and at that point lost his job and lost his insurance. He literally cried on the phone and said, "What can I do?" By that afternoon, I had him in touch with Dr. Arnold Turner at Provident Hospital, and I got a report from Ricardo a month ago. He's cancer-free. His prostate has been taken care of. All of that happened at Provident. So I'm so proud of that, and I want to share it with all of you.
That is amazing. All of the hand clapping emojis there. I see you, Priscilla, and really, Commissioner Lowry. I had the honor and pleasure of working with both Commissioner Butler and Commissioner Deere, and those are huge shoes to fill. And I can't think of a better public servant to step up to it and to not only meet it but to exceed it. So we're
Thank you.
grateful to have you as a part. An ongoing part of the team. And with that, I'm going to turn to Dr. Makaitis. I know that Commissioner Lowry hit on some of the things that we're doing at Provident and with the,
Sorry, doctor.
with the scholarship. No, look, that's what's so beautiful about this is that we've got so much going on. And because the system has such a big footprint, we're able to sort of feed off of this type of energy. But is there anything that you'd like to add
Absolutely.
about the work that we're doing there and how it's helping to propel new ideas and thought processes here?
Absolutely. And Commissioner Lowry, no apology necessary because you only scratched the surface. You said a lot of stuff, but it just scratched the surface. So, as you know, Shannon, Providence is a cornerstone of our health system, right? We've done a lot of investing there, 9 million over the last 5 years, really looking to bring on new services, expand what we're doing there, offer more services to the community, including, as Commissioner Lowry mentioned, inpatient and outpatient dialysis. He mentioned ambulance runs. We also opened an ICU and we've expanded our surgical services there. So a lot of really wonderful things happening. And we're seeing the recognition of the team there as well in December. So proud to share that Provident was named a top general hospital by the Leapfrog Group. And so just for background, I believe it was the only top general hospital in the state that was recognized and only one of 4 top hospital of any category in the state of Illinois recognized. So really just to stand out in terms of the team's dedication to high quality care. And again, congratulations to everybody on the Provident team. Just a wonderful achievement. And Commissioner Lowry mentioned a little bit of this as well, but in the spring, we're going to be opening our Bronzeville Health Center as part of the larger Provident campus. And as well, the Behavioral Health Triage Center inside of the Provident facility that will help people needing urgent behavioral health care receive the care that they need.
That is great and awesome. And I think it's a nice segue back to some of our frontline panelists on the call as you listen to the things that we have going on, which I'm certain all of you are aware of, that and much, much more. I'm going to mix it up a little bit, and I want to start with Dr. Grievous, just in case it's not lost on me that you are the only one amongst us in scrubs and could be called away at any moment. So we're going to let you take the first stab at the question, just in case we miss you. I probably could have used a better word than that, but can you speak to the importance, particularly for our patients? We just talked about having a footprint on the south side of Chicago specifically. Priscilla's out in Robbins. We are in communities on the south side, the west side, the northwest side. Can you talk a bit as a doctor and from your professional perspective, the very personal piece of the importance of patients being able to see doctors who are reflective of their community? Today, we happen to be celebrating Black History Month, and we have a very diverse population, and you are a African-American doctor. Can you talk about, from your lens and where and how you enter, why is that important? Why is representation important in that space specifically? And I think you might be still muted. Thank you.
Thank you for, again, including me on this panel. So I have kind of an interesting perspective. So in 1962, my oldest brother was born at Provident, believe it or not. So, and my brother has now gone on. I don't know if you've all ever seen that movie Underworld. It's got Kate Beckinsale and Danny Wiseman. And it's vampires versus werewolves. Well, my brother wrote that movie and he acted in it. He's the big werewolf with the deep voice. That's my brother. But he was born at Provident. And my mother, who is a Harvard graduate, often talks about the fact that being born, my brother being born at that hospital, she said it was an amazing experience. She said it was clean. It was wonderful. All the nurses were dressed in their whites. They would come by at feeding time, and it was just a wonderful experience. So I come from that lens. I have that lens. I am really into African American medical history, and Provident being the first Black hospital in the country, it means a lot to me. And just kind of coming forward into the new millennia, when I greet patients and see patients, some of the patients can't travel to Stroger. Some of the patients can't travel to different places, but there's a stalwart in the community, and that is Provident. And it's wonderful to be able to care for the patients in the community. It's wonderful to interact with those patients, and it gives people a level of comfort to see providers that look like them. It can't be understated, and that's why I am going to continue to push forward to bringing young people into medicine, and not just again on the physician provider side, but on the medical staff provider side, on the APP side, where we have physician extenders on that side. We need all hands on deck. And I always say, when we care for patients here, it's not just the providers, it's everybody. We are a family, we are a team. And the patients so much appreciate it. And again, one of the reasons I say that this is the best job I've ever had is because, when we are taking care of patients, they're grateful. Patients are like, thank you, I have this issue. And they're so grateful that we are here and taking care of them. And I want to push back on, some of the other institutions that are kind of around. I know that there's a new Northwestern facility going up just down the street from Provident on Cottage Grove and 48th. And they're going to have a big, huge, beautiful building, but I don't think that they're going to provide the care that we do. So, I want to call on commissioners like Commissioner Lowry and call on people to say, we need investment dollars for Providence so that our physical footprint can kind of match what they have at Northwestern. So our patients aren't duped by the bells and whistles, because we're the ones that care for those patients on such a deep level, on so many levels. We care. And that's kind of what I want to push. I know that a few years ago we had in the media, there was a media message that was going out. I don't know if you guys remember, but on TV, it said, Cook County, trust us. Trust us. And that's what the patients need. They need people and providers in healthcare that they can trust and know that they'll be cared for. But we have to do our part. Our part is being able to see patients on time. Our part is to be able to, if patients, don't have the resources, our job, to me, is to be able to look, what's the mission of the hospital, to take care of patients regardless of their ability to pay. So we'll take care of them and then get them into the programs that will help them to ultimately pay for it. But we need that. We need the funding. And the other thing that we do that no other institution I can say in the area does is that we take care of the CIRMAC patients. And, say what we want to, I have no judgment on any patient that I care for. The patient that's in front of me is the patient that we need to care for. And they deserve care just as anybody else does. And we care for those patients as well. And we try to treat them with respect. Every patient from CIRMAC, I call them Mr. Johnson or Mr. whoever, to give them that level of respect. So if you can see, that's what Provident brings. That's what the opportunity. I always think it's an opportunity for us to care for patients. And I again, always believe that it's a privilege for me to take care of patients. I tell young people when they're interested in medicine, I said, just think about this concept. Patients, if you're a surgeon, patients go into the operating room, they crawl on an operating table and stretch their arms out and say, open me up. I mean, it's an awesome responsibility, and we take it very seriously.
Thank you for that. I'm going to run out there on a limb and say, not only did your parents have a creative son and a scientist for a son, but it sounds like you got a little politician and advocate there. And your Commissioner Lowry, I say we sign him up for a trip to DC or something there. So your parents must both be really proud. Creative science, and now today we deem you a politician and an advocate for all things as well. Thank you so much for that. I'm going to turn now, and I said this a bit earlier when we were off camera. I had the pleasure of going out to Robbins to visit Priscilla Bennett and her team today. Priscilla, I wonder if you might talk a bit about taking it out of the hospital setting per se and going a bit further south in the county. As you know, we have a very diverse patient population. As a clinic manager at Robbins, why do you think it's important in that very community way, which is again different oftentimes than when people are coming into the hospital setting, but you're there in the community taking care of issues, I would suggest, from a different perspective? It's still about healthcare. Can you talk a bit about, through the lens that you see this, what is the importance of diversity and representation in that space?
The importance of us being located here in Robbins is a desert. It's a food desert, it's a medical desert, and for us to be here is paramount to the community and to our patients. Not only do we see just African American patients, we see a diverse range of patients, and not one patient is turned around. We ensure that every patient is registered and they're seen by one of our APRNs or our medical doctor. We make sure that there's templates available for the patient to be seen on any given day. We also have a walk-in triage where all of our existing patients, even if their provider has a full template or schedule, they can come in and see the patient or one of our nurses. And our nurses also will send a note to the provider and say, can you please refill this prescription for our patient? Last summer, we had the Chicago Food Depository here on site, and we had them for many years. They will come by monthly, and we will provide fresh fruits and vegetables, not just to our patients, but to the community. During our new patient arrival, Robbins Clinic was one of the clinics outside of Belmont Cragen where we saw a lot of the new arrivals. We had two agency APRNs who were just stationed here just to see our new patient arrivals. And they received the same care that you and I will receive. So everyone received the same type of care, the same type of lab service, the same type of financial assistance. One thing here at Robbins, we also have a dental clinic here. So they were able to be seen by our dental clinic. We have social workers, and we also have a financial counselor who were able to aid and assist with all patients who are not insured as well. So our presence here is not just important, but it's definitely paramount for us to continue to strive and provide health care to this community and to the surrounding neighborhoods as well.
And Priscilla, from your perspective, because again, having just been there, you have a really diverse workforce. That must be an important role in watching, or at least what I was able to see today in terms of the interaction between the people who are providing the service. I met your interpreter who was there. I met the financial counselor, but you really got the sense that it was a community taking care of the patient. So I imagine through that lens, the representation of your staff in terms of being diverse is important in that work that you do.
Absolutely. We go above and beyond, not just for our patients, but for each other. And one thing about my team, they will come together. We will call 911 if we need to ensure that the patient is diverted to the closest hospital. We ensure that communication is very important to the EMTs that come on site to transfer the patients to the emergency department. Yes, Ida is one of our interpreters. She's been here in this location for 19 years. My medical lead, Dr. Abiona, she's been here and the medical lead here for 11 years. So that really speaks volume of how the nurse, that Lenora, she has 30 years of service this year. So that speaks paramount of the type of staff that I have. They're continued. And they're here to do the work. And they love coming to their job. Like Dr. Grievous said, he loves his job. And my team love what they do here.
That's great. Thank you so much. Marley, we're going to shift a bit and talk about the work that you do at the health department. And I think, again, what makes Cook County Health so interesting beyond the diversity of people and the people that we serve is really the diversity in the range of what we do. We have hospitals, we have clinics, we have a managed care program, and we have a healthcare department. And I believe I heard you say a bit earlier, not only have you worked at Cook County Health Department, you previously worked at the City of Chicago Department of Health. Can you talk a bit, as we, celebrate Black History Month, the importance of representation in that space of healthcare? We talked about this a bit at the beginning. Healthcare happens in a lot of different ways. And the impact and the role that people have in it from the moment you walk in the door of a place that's providing you service. But what most people may not think about, and I think we all, although they may see it differently in a post-COVID world, there's an element of healthcare that, happens in conversation and with data and in rooms that are making decisions about things that impact your healthcare. Talk a bit about, if you will, the importance of having representation at that table and at that part of the healthcare dialogue.
Yeah, happily. So yeah, public health is a bit of a unique animal with respect to a clinical perspective. Our focus is largely upstream. So in general, there's the adage, an ounce of prevention is worth a pound of cure. So we focus oftentimes and heavily community informed, community co-designed um, preventative measures, right? Whether that's behavioral health, whether that's harm reduction, whether that's recently we had immunization programs that was a partnership between us and ACHN for COVID and flu vaccines to the community. So looking at preventing things from happening or mitigating things from getting worse, right? It's powerful to see folks that look like you, and especially when you're trying to educate folks, which heavily we pull heavily from education when you're thinking about trying to prevent, um, you know, uh, issues from being higher acuity or kind of getting to a point where they become clinical issues. So if you're thinking about harm reduction, you're going into communities and trying to build coalitions or connect with folks to have meaningful conversations. You want those communities, you want to build rapport, right? You want those communities to want you there. Ideally, you want those communities to invite you there. And so they have skin in the game. They have ownership of whatever the solution is for the harm reduction that they agree is an issue, right? So that is key. Again, that co-design, that communal rapport building, that it really helps if the community sees themselves in you. Um, Here again, similar to what Priscilla expressed, we have a um, very broad population within our 184 folks on our team that represent our Cook County population. We are the people of Cook County. We are the people of suburban Cook County, which is our jurisdiction. Both Black, Brown, and otherwise, we are heavily representative of folks we serve, both in terms of age demographic and ethnic background. That is certainly helpful for door opening and coalition building.
Very good. Thank you so much. If I may, I want to go to, because we may have to do a time check for the CEO here. Dr. Makaitis, is there anything that before we have to sort of close out today's discussion, and in case that we can't have you at the very end, could you maybe talk a bit about what you're excited about here at the organization as it relates to this notion of making certain that it's representation? There's so much great stuff that's going on. I really want to keep us in line with this thought process of what is it that we can all be doing and what are we doing as an enterprise to make certain that communities are represented in the space that we're in. But are there some remarks or things that you'd like to leave us with about the work that you're leading and driving us all forward to do here at Cook County Health?
Absolutely. Thank you, Shannon. And, I guess I would start with the Providence Scholarship, which is, I think, what got the broader discussion going of what I want to really talk about. But just a little background on the Providence Scholarship. Commissioner Lowry shared a little bit about it, but by way of additional background, we're kicking off our 4th year at this point of the scholarship fund starting this spring. And it's been because of the support of President Preckwinkle, Commissioner Lowry, of course, the late Commissioner Deere, the broader county board of commissioners, our CCH board of directors, the health foundation, as well as the county health foundation. It was their partnership and support that's helped make this a reality. But, we've already awarded $3 million over the last 3 years to 182 students, and it's been growing year over year. The first year it was only 30 students, then it grew to 60, and now it's 90. So we keep kind of expanding. And beyond that, that sparked a broader discussion, and Dr. Grievous kind of hinted towards it. There are the few conversations that we've had around it, this concept of you can't be what you don't see, right? And that we've now started engaging with local schools to engage at the grade school level, right? To bring our volunteers who are interested in engaging these discussions out to our schools, to where they can talk about what their profession is and what it means to be a physician, a nurse, a therapist, a clinic manager, a lab tech, right? It's across the board, and the engagement that we've seen from our team has been really inspiring in terms of the different folks who have really wanted to step in and talk about what they do day in and day out in that healthcare space. So that's kind of the beginning of what we're starting to build in terms of a more substantial and concrete pathway program into the healthcare space. We've already got the scholarship for folks who have committed to that education and having that career. And we're trying to help those people along with the scholarship program. But it's really about piquing that interest, when these potential learners are young and have those options and can kind of set themselves on that trajectory. Beyond that, we're exploring what a shadowing program might look like as students are reaching high school age. Engaging with Chicago Public Schools to look at, they already have a program, how we might engage with that. And then beyond that, talking with some of our local colleges around rotation opportunities for folks who are already in certificate or degree programs. We've already expanded immensely the spots that we have to allow their students to come in and actually train at Cook County Health. So really trying to create kind of a beginning to end program where we're able to pique interest at the early end and make it easy and a smoother pathway into a career in the healthcare space.
It's all about representation. And so thank you so much for that. Deborah Cooks-Reed, I did not forget about you. You're getting ready to get a twofer because I let you sit there for a while. So gear yourself up there. Talk a bit from the where and how you enter in the healthcare spectrum about who are the people that you looked up to growing up as you advanced in your career, and who, if there's one person or one institution that made an impact on your development.
Well, entering into the healthcare program and growing up, there were nurses in the family, but there was no one in lab. And everyone, when you talk about healthcare, they always want to say, oh, you're going to be a doctor, you're going to be a nurse. But like I said, when I was blown away by being a med tech, the idea of working in a lab, I just love it. And just you involve yourself. You're still helping patients. You don't necessarily have that patient contact, but you're concerned about the results you're getting because you know that's going to affect their health care. So you want to make sure you're getting good results to the providers so they can do their best to take care of the patient. As far as once I got into the program and I went to Rush University, that's where I got my 4-year degree in medical technology. And I've worked at University of Illinois and at Rush, and you meet different people who are passionate about what they do as far as being med techs. They're very conscientious about results they're putting out. If we can't get a hold of a provider, if it's a critical result, we're really trying to find ways to who can we get this result to, because they need to get this back to the patient. And we're paging, calling, now we can type or connect, but that's always been very important to me, or important to us as med tech, especially here in the lab. And
It's interesting you've hit on it, and I think some other folks on the call. It really is it's medicine, but it's a service. It's very much, and uniquely so here for us, it's a public service role, regardless of where and how you enter that space. And as we talk about the importance of representation, Deborah, I'm going to let you start us off with this question as well. And the workforce is changing, so we see how challenged we are. You have so many more careers and spaces to compete with. How and what role do you think that our listeners who are in this space and your colleagues, folks who can influence and impact, helping someone make a decision about getting into healthcare? Are there any nuggets or words of encouragement or things that you have in mind that would be inspiring as it relates to ensuring that African Americans continue to have a seat at the table and are in the spaces that matter for healthcare? And Deborah, I'll pose that question to everyone, but Deborah, I'll let you kick that off.
I think it's important to talk about what you do in the hospital. Talk about what you do in health. You have to talk and express. Young people, I know the grade schools, high schools always have career days. Get out there, being a parent, grandparent, aunt, uncle, talk to the young people about various careers in healthcare. It does, there is so much to do out here. And I think that's the thing. We have to expose it, have to explain it. Oh, I don't like blood, or I don't like, this or that. But there are other things you can do. It's offices, it's clinical coordinators. There's so many things you can do to help improve the healthcare among our people. And you just have to get out there and talk, explain. Churches, I know churches many times have career days and they talk about these things. We have to get out and talk about what we do. Sometimes we have to come out of our comfort zone and be willing to talk and address what we do or what can be done in healthcare.
I think that's great. Mark, Dr. Grievous, I'm going to kick it over to you next. What do you think we need to do more of first of all, who influenced you and who inspired you? And what do you think those of us who have a role in healthcare and touch in that space, what should we be doing to inspire the next generation of healthcare professionals and workers?
Sure. So I think that we need to have an ecosystem of encouragement. Our kids, as they're going through school, I have a 16-year-old who's at Whitney Young, and it's very challenging, particularly for young men of color, to navigate through this ecosystem without encouragement. He has had one African American male that has been amazing to him, navigating through that school. One, he's had 3 African American male teachers, but one that's been super encouraging. And you can well imagine that his grade in his class is, nearly a perfect score. So the thought process is that we just need encouragement. As I was going through, I absolutely had surgeons that were encouraging to me, and they weren't all African American. Certainly, if you ask me, they're mostly majority Caucasian males that taught me surgery, because that's our ecosystem. I mean, there's not a whole lot. So these are the ones, and they're wonderful, wonderful men. And so I always make sure that I state this, that, just because, somebody is not your color, it doesn't mean that they're not your kind. Because my pastor told me years ago, he said, everybody your color is not your kind. So, we have to look for those areas and those folks that are very supportive of us. I remember I had a surgeon, his name is Ken Swan. And when I was a second-year general surgery resident, we were doing a number of general surgery procedures. And he was like, here's the knife. I'm just going to sit here. And he used to sit there and watch me operate. And I'm just so grateful that I had someone that said, hey, okay, well, make sure that you make this incision here. Make sure that you're cognizant of what you're doing. And, he told me many years ago, he says, I haven't spent one day in court. And he wasn't bragging, but he was saying, because I care for my patients, I really care. And he was so encouraged me. So that's kind of what I, try to do. I try to encourage young people as they're going through, if we're in the operating room with medical students of all different backgrounds. I treat, we treat all the students and residents the same, and to say, hey, you make your incision. If you make your incision and you're beveling one way or the other, I just said, you just have to make the incision more perpendicular. That's what you have to do, but you're doing a great job. So I think that this ecosystem of encouragement is what I call it. It's so important. I think it's helpful. I think that also navigating through the tests, and as they're going through in medical school or, undergraduate school, as you're going through, the tests are important. So you have to learn the information. And so we just have to kind of figure out ways. There's this concept called tutoring for excellence, right? You don't necessarily get a tutor when you're getting a C. You get a tutor so that you may get an A. And I don't think that our kids do that enough. I don't think that they're getting tutored for excellence. And so those are just some of the ideas. As you can see, I talk a lot. I have a bunch of ideas. And
I'm going to say you got that from your brother, the right. Now I'm stuck on that you've got someone write movies and someone talking about putting people over. I love this. So it's interesting. So Deborah talked about communicating and making certain that we're seen. Dr. Grievous, you talked about the importance of encouragement. Marley, I'm curious if you could talk a bit about what do you believe we need to do to make certain that God forbid, for the next pandemic, many, many decades away, so far, we can't even think. How do we make certain that there are people in the room having the conversations about public health? What do you think we need to think about as we try to think about inspiring the next generation?
Well, for one thing, I want Mark's book. As someone who has a little black boy at home, yeah, I'm looking at you, Mark. Pause for all the little black boys. So I think everything that we do every day incrementally, cumulatively builds to the next big whatever it is, right? Whether it's a pandemic, crisis of any kind, right? We build sustainable, intentional infrastructure because it's the right thing to do. And the same is true about building up people. I'm a big believer in sponsorship and mentorship. So I meet Mark's encouragement and I raise you a sponsor. I think it doesn't happen enough that we speak each other's names in rooms where we're not present. I think, throwing folks' CV into a room, when you know that there is a job available, or, coaching folks up for an opportunity, whether it's someone on your team, because again, it's not necessarily about just what you do today, about all the tomorrows that come next, right? And that goes too for your peers, whether you're managing up or just folks that you meet with socially. I think sponsoring folks in the way that we build each other up professionally, and not with a quid pro quo in mind, but just because it's the right thing to do. And the funny thing about that is there's a ripple effect. It's a beautiful thing, and it's going to be the thing that'll take us through these next 4 years.
Yeah, building up and support, and I love that it's the right thing to do. I'm going to do a time check. If everyone is Good. I've just got I was right on time too. We've got 5 minutes. I do want to hear from Commissioner Lowry and Priscilla really quickly about the inspiration question. And then I'm going to tell you after that, there's one last question, and I'm going to let Commissioner Bill Lowry have the last word on that. But Commissioner Lowry, could you tell us before I turn it over to Priscilla, what do you
Sure.
think we need to do?
Yeah, I'll be really succinct. It goes to the see it to be it that the doctor talked about at the outset today. And in addition to the Providence Scholarship Fund, I want to also shine the light on the Superior Ambulance Jump Higher and Stroger initiative, where I just went to a graduation. 17 of our young adults received their EMT certification, emergency medical technicians. These are the types of initiatives that will do exactly what you posed, Shannon.
Absolutely. Thank you for that. And Priscilla, quickly on the inspiration question, what do you think we need to do to inspire the next manager of a community health center?
With our new generation, social media is a big hit. So I feel like if we market more on social media, if we go out to the schools more frequently, consistency is key. So as long as that we're consistent in these school systems, going to career day, going into the churches, marketing more on social media, we're starting to become present. And instead of us being the back front, we'll be in the forefront of their memory. Like, okay, I can do something in healthcare. Like Deborah Reed has mentioned, not necessarily a doctor, not necessarily a nurse, but she's a phlebotomist and she loves what she does. So if we continue to strive and make these awareness known, the children will know, like, yes, I can go into healthcare. My big instrumental paramount factor of me being in healthcare is my mom. Like I mentioned before, she worked at Oak Forest for many years, and that was my niche into the healthcare field.
Very good. I love that. Meet the people where they're at. We got to meet the young folks where they're at. Okay, so as promised, this is my last question. I'm going to start with you, Ms. Deborah Crooks Reed. Final question. As we close out Black History Month, what does this month mean to you?
Okay, Black History Month to me, it signifies the past, the present, and the future. We're looking at achievements made in the Black community. Also shining light on the generation after me, that we are making straight strides. And I'm sorry, I get choked up about this. That progress every day, and we still have a way to go. They have to understand we still have a way to go.
No, I appreciate that. Thank you so much for your passion for that. Priscilla, what does Black History Month mean to you?
Black History Month means to me is it's an important time for reflection, celebration, and education. It allows us to recognize the many contributions that Black individuals have made to society across all fields, from civil rights to science, the arts, and beyond. For me, it's a chance to honor those who fought for equity as well as to reflect on how far we've come and the work that still needs to be done. It's time for me to learn more about Black history, embrace culture pride, and also think about how I can contribute to a positive change moving forward, just like Deborah has mentioned.
Thank you so much. Marley, Black History Month, what does it mean to you?
It's a time for humility. It's time for reflection and humility of how far we've come and how far we still have yet to go. For me, it's also a time for me to dig deep and make sure that my kids that we don't forget. It's a time for memory and to hold on. And this year we need to hold on a little tighter.
Holding on. Thank you. Dr. Grievous, what does Black History Month mean to you?
I believe it's an opportunity for education. We have to, I have to constantly go back and sometimes kind of reread things that I've read before because we tend to forget, right? We tend to forget our history. So it's a time for education. I believe that, we stand on the shoulders of giants. If I've stood any higher or seen any further, it's because I've stood on the shoulders of giants. And, there's no way that I could do what I do unless people have gone before me. And, when I'm talking to young people, I tell them it's like the person that's environmental in our hospital you have to give them respect, because it was those folks and their parents that fought on the front lines so that we could go to school. And I think that that's what I love about Black History Month, that I can kind of reread and talk to my son about, rereading the history and understanding what sacrifices went before us.
Thank you so much. And lastly, we're going to have our leader, Commissioner Bill Lowry, close us out with the last question, with the last thought on that question before we say goodbye. Commissioner Lowry, what does Black History Month mean to you?
Thank you, Shannon. For me, Black History Month serves as both a celebration and powerful reminder that Black history is American history. Black people built this country. Black culture is copied in this country. And yet the Black experience in this country is a story of struggle. But it's also a story of perseverance, it's a story of aspiration, and it is a story of progress. Understanding Black history has never been more important than today, as we continue to fight for economic equity and health equity, and as we see the dissolution of DEI amidst the expansion of minority status as defined. So what's our path forward? I think we all must continue to prepare. We must continue to be purposeful. We must continue to push. And in the words of one of my heroes, Shirley Chisholm, if they don't give you a seat at the table, bring a folding chair. It is time for us to bring our own folding chairs, because we will not go away and we will be at the table.
Thank you so much. Those are beautiful closing words. I would like to thank everyone for joining us this afternoon for this important discussion. I really want to thank our panelists. We could have done this for hours. That's how great all of the nuggets were that you gave us. As others have mentioned, our diversity is our strength, and today's panelists certainly have demonstrated why representation matters. So as Black History Month comes to an official end, I hope we can continue to support one another and push forward with our commitment to representation, access, and excellence in healthcare. Happy Black History Month, and thank you to our panelists for sharing their stories today, and thank you so much to all of those of you who joined us for today's discussion. Happy Black History Month.
Thank you so much.
Thank you all.